Well, welcome to another Cutting Edge show. I'm Omar Neal, one of the hosts of this great program. I'm the former mayor of Tuskegee, Alabama, and host of the You Got the Power radio talk show. This program is being brought to you in part by the University of Maryland School of Public Health. Today, we're going to have a very interesting conversation as we talk about COVID-19 moving from pandemic to endemic and surviving through the process. We have really had to focus on a lot of things. And so we're going to have the right person to talk about it. But before we do any of that, I got to bring on my co-host, sidekick, brother from another mother, Dr. Stephen B. Thomas. We call him Dr. T around these parts. Hey, Dr. T, how are you doing?
Mayor Neal, what a great time to see you again. Another week, another opportunity to educate our community about what's happening. And they need it more now than ever, my friend. People are throwing masks away, throwing their caution to the wind.
Yeah.
And it's one thing to tell people it's optional, like on an airplane. But it's another thing to walk down the aisle with a trash bag and encourage people to throw them away. Mm-hmm. That's the message going out there that's going to put us in danger.
Right. Well, we obviously know that people have to do cost-benefit analysis. And again, you have taught me this, Dr. T, that we can't shame and blame.
Nope.
But we do need to inform people. And it's important that we get the messaging right, because believing that when people get proper information, they naturally gravitate to take care of themselves. But we got somebody today that's really going to help us unpack this.
Absolutely.
And he's all the way from Alabama, man. So
wait. You say Alabama?
What did I just say? I said Alabama.
That's where you are.
Clear. That's what I'm saying. Can't you see how I'm smiling? I'm so happy. And I tell people all the time, I am so proud of the work that we're doing here, particularly as it relates to COVID-19 and the information dissemination and the people who are working with public health. The way that they are thinking out of the box, the more proactive way by which they are dealing with this issue of COVID. And we believe that lives have been saved as a consequence of that kind of initiative on the part of public health here.
Absolutely. And I was so impressed when we had representatives from your great town describe how right there at Tuskegee University, they have the cold storage. Mm-hmm. They're like a repository for the state. And then the ad councils helping us reframe the U.S. Public Health Service syphilis study at Tuskegee. So you're at the center of solving the problem. And I think that's wonderful.
Yeah, man. And so I'm really excited about it. We have some people behind the scene that I want to always acknowledge. What happens is that people see you and I out front, and that's good.
Yes.
But we can't do what we do if it were not for the people who are the team behind the scene, headed up by Meg Jordan, who is our technical director. Maggie Daly is the assistant technical director. Saraya Khan, who is the social media and communications guru.
Yes.
Kimmy, we call her Kimberly, but we call her Kimmy Fleming, social media and media curator. And of course, Elijah Pugh Jr., our sound designer. Yeah. All of these individuals make us look good, Dr. T.
Hey, I was tapping my feet as soon as the soundtrack comes on.
Oh, absolutely. Yeah. And that's an original soundtrack made just for the Cutting Edge. So we are really excited to have our own soundtrack. So all of that's wonderful. Don't forget you can like, subscribe, and share this particular show with your friends, family, and acquaintances. You can catch us on Facebook, YouTube, Instagram, Twitter. And so make sure that you like, share, and subscribe to our pages. Don't forget, we do have a newsletter that comes out each and every week. There's the QR code. You can put your phone right there and you can get your newsletter And of course, once you get in the database, we'll make sure that you get a newsletter each and every week.
Got to
It
stay
is
up to date.
very, very informative. It keeps you up to date. It's also electronic, so we will put the previous show on, highlights from different shows that we've had on. So it's really dynamic, and so you'll really, really be appreciative of being engaged with our newsletter each and every week. Well, Dr. T, you know this is National Minority Health Month, and we salute it here at the Cutting Edge. We had Black History Month, we had Women's Month, and now we have National Minority Health Month. And, you know, I'm excited about that because of several things. One is, you know, Booker T. Washington, who was very instrumental in really bringing to consciousness to be intentional about addressing minority health. And so, being a Tuskegee man, we're going to do that. So, but we're going to share a little bit about that with you. But before we move any further, you wrote about this.
But what's so interesting about this history, Mayor, is that it came out of Tuskegee, which we call a sacred space for our history of freedom. Okay. It was culturally tailored. And when you listen to Booker T's words back then, 1915, okay, he was describing health disparities like we are today. And you know what else? What you're seeing right here is how they organized their Health Improvement Week. They used the church revival as a model, and everybody knew the rhythm, but they just replaced the scripture themes with the health themes. I think it's brilliant. And in many ways, Mayor, we have a playbook that's been left for us by our ancestors. How about doing some reenactments of the National Health Week?
You know, if you think about it, everything that Dr. Washington was talking about is applicable today. Think about mobilization of the day. That's to get people mobilized.
And it starts on Sunday.
Starts on Sunday. When you want to start something, start it on Sunday.
There you go.
Right. And you end on Sunday. So
That's
you start on Sunday.
Everybody knows.
Sunday,
everybody knows the rhythm.
Right. Home Health Hygiene Day.
Yep.
Right. Community Sanitation Day.
We were suffering from diseases of poor hygiene back then, mosquito-borne diseases, and they came up with strategies specific to eradicate those sources of risk.
Right.
Look at Wednesday.
They had a special campaign day, and adult health day, and then had school health day.
Ain't that amazing?
Right. Isn't that something? So even back then, he said that school and adults, all of you all need to have a health day.
That's right.
And then general cleanup day. If you notice, there's a theme about cleaning up, because cleanliness is next to godliness.
There you go.
Right. And of course, reports and the follow-up day.
Now stay there just for a second.
Yeah.
They published the results of their work. They did evaluations. They collected the posters. And Mr. Mayor, they published these in Crisis Magazine, the official publication of the NAACP. All this has been left for us, but it's sitting in boxes in libraries with dust. Time to blow the dust off and put the playback in service.
Absolutely. I agree with that. So we're excited about it. We did a special on Dr. Booker T. Washington on last week, and we're following up with him this week. Again, his contribution towards our consciousness of health is immeasurable. And so we're appreciative of that. Well, Dr. T, I'm excited.
Oh,
I told you I was excited, right? I'm excited because we are welcoming back, by popular demand, a dear friend of mine, a person who heads up our health departments all over the state. He's the state health officer for the State Department of Public Health. And so he's the top person in the entire state as it relates to health.
Are you saying the buck stops at his desk?
The buck stops at his desk.
All right.
And so he has to have like the panoramic view of health for the entire state of Alabama. And so there is no better person to have to be at the ham, to be the watchman on the wall
There we go.
for the state of Alabama, other than Dr. Scott Harrison. Ladies and gentlemen, please join me in welcoming my dear friend, Dr. Scott Harris. Hey, Dr. Harris, how are you doing?
Hey, I'm doing great. Thank you. Thank you so much for having me. It's great to be with you again, Mayor. I just enjoy this so much. Dr. T, it's great to see you again. I really appreciate this opportunity. I appreciate you using that picture you just showed. That was pre-COVID. I was about 20 years younger. It's wonderful to be back. I just appreciate the work you all are doing so much, and just thrilled that I can participate a little bit in it.
Yeah. Well, there is a saying that Fannie Lou Hamer says, and I know that it's applicable today, that people are sick and tired of being sick and tired. 2 years into this, and in a few months, and we are still grappling with what to do to protect ourselves and our family. We have had an onslaught of disinformation and misinformation that's been disseminated through the social media and other spaces, Dr. Harris. And so many people are confused as to what to do now. And I know that you are kind of monitoring messaging all the time. Where are we today as you see it?
It's tough right now, Mayor, and as you said, people really are tired. People have endured a lot. They're resilient, but they've endured a lot, and we've asked people to make sacrifices, and many people have. Most people have. We've asked people to hang in there and follow all these rules and get these vaccines and consider these medications and all these things that are disruptive to their lives, because we have, held out hope that we're going to get through this. We're going to get back to some sense of being normal again. And we are going to do that. But, we're not quite there yet. We still have a ways to go. We need people to still be observant. We need people to exercise care. We need people to just be aware of what's going on. And so we still have a ways to go to get out of the woods, even though we're in a better place than we've been in a while.
What about the subvariant that seems to be sweeping the nation? How is that has that infiltrated Alabama, and to what extent?
Yeah, the most recent subvariant we've seen is known by the initials BA2, and it's a version of Omicron. We are seeing that in Alabama, and in fact, it's more than half of all the cases in the United States as a whole. Probably significantly more than half at this point. That it was more than half about a week ago, so it's probably continuing to go up. We have had so many people in this country recently infected during the Omicron surge that a lot of those people probably have a little bit of protection on board for a while. That's why we're not seeing these BA2 numbers take off maybe as fast as we've seen in some parts of the world. Mm-hmm. We're a little nervous, and I would say in a state like Alabama, where we live, where people haven't fully embraced vaccinations, I'd say we're real nervous because we know that immunity that you get from infection not going to last forever, and we're just worried that we may be facing some more tough times in the future.
We talked about it before, Dr. Harris, and I don't like to be critical of government, but I think that we may have spiked the ball in the 30-yard line. And that's not a touchdown, that's a fumble, right? I think I think that we probably should have emphasized boosting the booster more and not letting our feet off of the gas with that. What's your take on that?
Oh, Mayor, you said that perfectly. I mean, we've got people there trying to take a victory lap, and we're nowhere near the goal line yet, as you said. I think sometimes it's just how we normally behave as humans. We really want to get back to some sense of being normal. We don't like having to change our behavior. We don't like thinking about things that we don't want to think about. And as soon as we have a little bit of hope that maybe things are improving, we want to move on to something else. But what we are trying to do in public health is just get people to remember that they need to exercise some caution, that they need to be careful, particularly our most vulnerable people, people who are seniors, people with chronic health problems. But we also know disproportionately in Alabama, our communities of color have been affected. And so we want people to understand if they're at high risk, if they are at risk, as many people are, and we want them just to use common sense precautions and not forget about this.
Dr. T, you want to say something?
Yeah, Dr. Harris, I'm watching how things are being framed. And, the mayor says all the time, how you frame the issue depends on who embraces the cause. Okay. So if they would have said mask optional, I put my mask in my pocket if I wanted to. But we just had a Zoom town hall, had a physician on when she was in an airplane when they made that announcement. It was Dr. Hancock, who's been on this show. I could hear the emotion in her voice because people on the plane cheered. And then the stewardesses, flight attendants, walked down the aisle with a trash bag for people to throw their mask in. Now, to me, that's like a bridge too far. Why would you throw your gloves away when it's sub-zero outside? What metaphors can we use now, not to fear, but to keep people vigilant?
Yeah, I think it just comes down to awareness. If we had to choose one single word to describe what we do in public health, it's educate. That's what we're here to do. We all need people to teach us the things that we know in life, and we learn things from our parents and from our teachers and from people in our community. But when it comes to healthcare, most of us need to ask a specialist in healthcare to help us understand what we need to do. Most of us just don't come by that knowledge normally. So we're just trying to get people to pause, to think twice. If you're someone who's going to be in a situation where there are other people and you don't know their vaccination status, if you're going to be in a situation where you're indoors for an extended period of time around groups, those are all the kind of situations that we need people to stop and think twice about. And then ask themselves, what do I need to do to protect myself? It's really just awareness. It's not hard. For 2 years now, we've had a pretty good sense of how you can catch this disease and how you can't. And I mean, the science changes a little bit, but it's mostly people indoors, close together for an extended period, and particularly now people who aren't vaccinated. And if you've got those ingredients in the recipe, people are going to be at risk. So we trying to get that message.
So you imagine in a barbershop or a salon, you can't do what they do 6 feet away. And Dr. Harris, I think you would be very pleased to know, and the rest of the audience listening, when I made the rounds in the field this week, in our shops that are part of this network right here, the sign on the door said, mask required when you enter. So our folks are not relenting, but there's peer pressure out there. And we need to be able to help them stay the course.
Listen, that's absolutely true. I think most of us behave the way that we see other people around us behaving. Idea of what your community norms are. How are other people acting? That's probably how I'm going to act. And so with masks, it's such a simple, cheap, easy solution to a lot of problems. They're not perfect. They don't fix everything, but they're highly effective. They work very well. Doesn't take much of an investment. It's not a lot of trouble to wear one for most of us. And so you're exactly right. If we just encourage people to remember to wear them, whether the government is going to require it or not require it, doesn't change what I do. I have to make a decision. And if I do it and the people around me do it, then others are going to see that too, and they're going to do it.
You made a salient point. Although the government does not require it, doesn't mean that you can't do it or protect yourself.
There you go.
Is that right? And I think some people may have misinterpreted it by saying that since the government is not requiring it, then I shouldn't do it. It doesn't mean that. It means that it's no mandate, but you have the prerogative to wear your mask if you feel the need to do it. Is that correct, Dr. Harris?
Absolutely. I mean, you just said that perfectly. I think there are people out there who sometimes, unfortunately, look for a reason to not do those things. And so they can point to that and go, look, I don't have to wear one because the government's not making me. But that's not how we make most of our health decisions. Most of the things we do to keep ourselves safe and healthy, the way we protect our families, aren't things that the government orders us to do. They're things that we just understand are the right things to do.
Yeah. Let's bring up Dr. Carol Ritter. I want to talk with her a second. She is our resident physician, OBGYN specialist, and we are so appreciative to have her. Dr. Harris, she's been with us since almost from the beginning. I don't even remember when she came. She's been with us so long, and so we're so appreciative of her. Say hello to Dr. Ritter. Dr. Ritter, meet Dr. Scott Harris.
Hi, Dr. Harris. How are you?
Hi there. Great. It's great to see you.
Yeah, thank you for hanging in there with this whole pandemic. It's been a journey, hasn't it? I guess you have good boots because you're still here on the journey.
I'm still standing. Yeah, that's right.
Dr. Ritter brings also these conversations we have here back to the Maryland State Medical Society, a whole kind of different group. And that kind of cross-fertilization is helpful. But Dr. Ritter's seeing patients every day. So she's on the front lines. What are you seeing in the office, Dr. Ritter?
It's an interesting journey this week. I have become a little nostalgic this week because I went back on some of the webinars at the very beginning of the pandemic when they modeled, what we could expect with this pandemic. And I shared a slide with Dr. T that showed the waves of the pandemic and, the waves of COVID coming up and down, the waves of acute illness coming up and down, the wave of chronic illnesses, coming up and down. But what has started from the lower level and then has come up and modeled to not come down is mental health. And I've seen that in my office this week. It's like the triggers of mental health are everywhere. So we're not going to get rid of this. And I've been a little nostalgic too, because my dad would have been 106 years old. And there's been a picture that I've seen of him my whole life when he was 3 years old. It was in 1919. He was 3 years old. And it's one of those old pictures where he's in a soldier uniform with a musket, a gun, that's staged in 1919. 1919. That was just like, okay. So I always knew that my dad had the Spanish flu when he was 2 in 1918, and he survived, and he had 3 siblings that didn't die. But I never looked at that 1919 picture the way I look at it now. He had 3 siblings that died. He had just recovered from the Spanish flu, and his parents brought him to get a picture in a soldier's uniform because it was World War I. And they wanted to, like you said, Dr. Harris, they don't want to think about what they don't want to think about. They wanted to be normal. So I never looked at that picture of my dad in that way before until we've lived through this pandemic. The mental health, we just are covering it over, but then it bubbles up, just I've seen in the offices. It's going to be here forever. This COVID in one way or the other.
Well, it's certainly staying with us, and we're going to talk a little bit about long COVID too. We got some stuff. Dr. Harris, I think Dr. Ritter hit on a salient point. We don't know. We all have been impacted in some way by emotionally and psychologically by what is taken place with COVID and how COVID has impacted us. Distancing ourselves from our loved ones and friends and associates, that has an impact on who we are as people. We are communal as people. We want to be in contact, close proximity to people we love. We want to hug them. And there are people who've had loved ones to die. I mean, my mother passed and her sisters couldn't even come to the funeral because of the limitations that they had in terms of the number of people we could have that was doing that time. And can you imagine your family cannot come to be with you during that time? My uncle just passed just Sunday, this past Sunday, and so hopefully the family will be able to come together for his service. But I mean, the psychological effect, I don't think we think enough about. Have you all thought about that in terms of public health?
We think about that a lot. I think sometimes we wonder what resources we have to bring to solve those problems. I mean, they're huge problems, and I'll say that recognizing first of all that Mayor, we live in a state that hasn't really prioritized mental health ever. I mean, pre-pandemic, so we have this pent up need out there that hasn't been addressed before. But then on top of it, now you superimpose the just trauma really of going through the pandemic, and some of it is our response to the pandemic. As you mentioned, we've got people isolated and people who can't get together, and those are really problems that make it worse. But then the pandemic itself, we've lost now just under 20,000 Alabamians to this disease. 20,000. And for the past year at least, since vaccines have been widely available, the majority of those deaths didn't have to happen. I mean, they're preventable.
Right.
And so clearly that plays a big role as well. We're going to have what we are starting to think of as a health debt that's going to have to be paid for years to come. And it starts with the mental health things that you talked about. But, we've also had 2 years of kids not getting routine vaccinations,
Right.
Women not getting mammograms and pap smears like they normally would, people delaying going to get their heart disease managed, all sorts of things that people have put off or avoided or been unable to obtain. And that's a health debt that's going to have to be paid.
Wow.
Dr. Harris,
you hit on a salient point. Go ahead, Dr.
You said the word trauma. I just want to come back to that because, trauma uncontextualized looks like something's wrong with the person. Mm-hmm. And so we've been through this. If we don't want to think about what we don't want to think about, as Dr. Ritter says, we'll see this trauma play itself out and think, oh, there's something wrong with Omar. Mm-hmm. There's something wrong with Carol. There's nothing. It could be the natural reaction to the trauma. So making sure that we contextualize what we're going through, create the space for people to share what's happening. And if we don't do that, let me do it like this. If we do that, maybe we can get rid of some of the stigma associated with emotional wellness. It's the term I'm using now instead of mental health. Mm-hmm. Emotional wellness, maybe less stigmatizing. Managing stress, maybe less stigmatizing, but at least getting people into the kind of social support networks they need to heal themselves. Can that work?
That's a great way to characterize it. I hadn't thought of it in exactly that way, but you make a fantastic point. That is exactly what we have to do. The mental health effects that Dr. Ritter was just referring to, I mean, we really, I guess, should have expected them, right? I mean, we're seeing them, we recognize them, we understand it, but we probably in public health didn't think that they were almost inevitable in a way. And so that is a really great way to think about it.
Yeah. One of the things that I do know is that everyone has been traumatized to some extent. I don't think anybody has escaped some level of trauma associated with COVID-19. We all had to isolate ourselves. We all had to modify our behavior and our patterns of living. And so as a consequence, either whether or not it's can be seen or unseen, we all have been impacted by what has happened here with COVID. Let's do this, Dr. D. Did you want to say something before?
I want to say, and our barbers and stylists are seeing it every day, and in many cases, they see themselves in that gap around these mental health issues. And Dr. Harris and Dr. Ritter, we want to prepare them to know when to refer. We want to prepare them to what are the signs and they're seeing, not only in their clients, but even in themselves. And that goes for us too. And that's why the word cloud we do every week is so important. And Dr. Harris, this is one of the activities that we try to get a pulse beat on how people are feeling. You think we're ready for the word cloud, Omar?
Well, we're going to do the word cloud, but what I want to do is let me do this. I want to get the numbers. Can I run the numbers with Meg first? Because I think sometimes, we have this thing, Dr. Harris, where we try to put in context where we are. And oftentimes when we see numbers going down, we say, well, we're okay now. There was a saying, somebody said this once and made all the sense in the world. They said, well, how many deaths are acceptable to you? They said, I don't know. They said, would 500 deaths a day be acceptable to you? And they said, yeah, I guess that would be okay. And then I said, now look back behind you, and all 500 of those people are your relatives. Now, how many deaths will be acceptable to you? And they said none.
Context matters.
I think that's where we need to get. There is no death. And Dr. Harris, you were correct. A significant number of people who have passed, the vast majority did not have to die. And that's what makes this pandemic so tragic, is that we lost people needlessly to a disease that we had some remedy for, and that's a virus that we had some remedy for, and that's what makes it difficult to swallow. Meg, tell us about what's happening with the numbers today.
Absolutely. So this week we had 400,000 new cases of COVID-19, and we had 7,000 new deaths from COVID-19. 1 million Americans are newly vaccinated in the past week.
Newly, all right, come on now.
Yes. And 1.5 million Americans have gotten boosted.
All right.
Excellent. So that brings us to the total. We are at 80.4 million people in the United States who've had COVID. We are at 986,000 people who have died of COVID-19. We are at 218 million Americans fully vaccinated, about 2/3, and we are at 99 million Americans boosted.
So we are going to have to really boost the booster.
Yes.
Obviously we know that the people who are the most vulnerable, people 50 and over, the immunocompromised individuals they need to be boosted, and we need to talk to people about that. We need to be intentional about it. If we know somebody who has not been boosted, we need to talk to them. We need to also promote our protection.
Yes.
That's another thing. I've had one booster, and my second booster shot, it has been scheduled for next Thursday at 10:30.
All right.
Right. So I know exactly when I'm getting my booster, right? So I've had 2 first shots, my booster, and my second booster is next Thursday at 10:30. I'm intentional about it.
There you go.
Right. And I don't have any problems with letting you know. We have to promote our protection. Right. And we want you to be protected as well. Go ahead, Dr. Harris.
I'm sorry, I didn't mean to interrupt, but that's exactly just what Dr. T and I were talking about mask earlier. It's what's normal around you is kind of what you probably do. And if you know that your friends and family and people that you see on television and people you know in your community, if they're getting boosted, you'll probably be open to getting boosted. And so you're right, we do need to promote that. I've just got my second booster, by the way. So I've had my first 2 shots and my first booster, and now my second booster. So I think that's a great message to get out there. People will tend to do what others around them are doing.
And you Mayor, also go ahead, Dr. T.
So Mayor, early on in the pandemic, when we talked about the barbershops and the beauty salons being sacred spaces, they're spaces where social norms are set. So when you come into the shop and in our Hyattsville shop, and you see the sign, mask required upon entering, and everybody's in their mask, then that's role modeling. And we had some mothers in there with their young children, and they wanted to know ahead of time, hey, what are you doing to protect against COVID? I want to know before I bring my son. And so it could be a business differentiator that you're protecting people in your shop, and actually promote that. Because you in that business, you don't know who you're sharing air with. And if you don't know who you're sharing air with, put that KN95 mask on. And Dr. Harris, we want to make those respiratory protection easily available to people. And that's one of the things we're doing to make sure that those KN95 masks are available in our barbershops and salons, as well as the rapid tests. And on this show, we've done demonstrations of how to do the rapid test. So these kind of things help demystify the process and give people skills to protect themselves and their family.
Yeah, you're absolutely right. Let's bring Sandra Jenkins up, and let's talk to her, hang out with her a second. Hey,
you know, we might need to get that pulse beat now.
We're gonna. Oh yeah, that is right. We'll do that. But let me say hello.
You do
to
that with
Sandra.
Sandra, yes.
Yeah, we could do that. I bring her up. Hey, Sandra Jenkins, how are you doing?
Good evening, everybody. It's so wonderful seeing all you guys tonight. And thank you so much, Dr. Ritter. And, your information is just so awfully so valuable in this setting, especially in our barbers and beauty salons. I like to share that, taking on that additional step with asking questions upon folks as they're entering the salon. Have they been exposed or have they traveled out of the country, is really a means of preparation and getting them to really realize that you're taking a stance against, spreading the virus in your salon. So preparing them without having to say to them directly, show me your vaccination card or anything like that could be pressing on an individual, or either salon owners that may think that that is a means of really deterring people out of your salon. But actually, there is a protocol that can actually be placed for folks to really realize that you care. And when they know that you care, they send their children, they send their elderly, to your salon. So being that role model is beyond, just, wearing your mask, but taking the necessary precautionary measures and displaying posters and signs and things of that nature, and having those really like deep conversations when someone discusses, the fact that there's a family member that has been diagnosed, and then there's someone in the household that is not impacted as badly of the virus, but yet the elderly is right now suffering a little more. It scares them. So, providing that place there for their mental being is just really, it can be somewhat of a challenge, but we know that we're all in this together. So,
Absolutely.
It's one time, it's a bittersweet experience.
Yeah, you said something very salient, Ms. Jenkins, when you said about caring. What I am convinced of is people don't care how much you know until they know how much you care.
Mhm.
Right. And so just, this notion of genuine caring. The other thing too is we're going to talk about trust and trusted messengers. We talked about it before, Dr. Harris, but we're going to talk about that. But before we do any of that, let's get a pulse on what we're feeling collectively. Dr. T, tell them how we can do that.
So, audience out there and everyone here in the Hollywood Squares, think of a word that best describes how you're feeling right now at this moment in the pandemic. And just drop that word in the chat box. For those of you on Facebook, social media, you can use your Q&A box. Just drop those words in, one word at a time. But for the next 30 seconds, just drop those words in, as many words as possible, one at a time, that reflects how you're feeling. And our crew behind the scenes will build the cloud. And the more people who say that word, the bigger the word will be. and they'll let us know when that's ready. And so while they're doing that, we can continue our conversation, just keep those words going. And Sandra Jenkins, while you're typing in your words, tell Dr. Harris where you're from.
Well, I'm from Pennsylvania, Elkins Park, Pennsylvania. My salon is a naturalist studio. Everyone knows of it, naturalist, but we go by just a root word, naturalist. And we're located in Montgomery County. So that's where we are. And, this whole experience has taken things to another level in the midst of right now studying to become a community health officer. And I must say, it's well needed in this community. The barber and beauty industry has taken on a new face, and this is what we need to do.
So Dr. Harris, she's on the path to becoming a certified community health worker in the state of Pennsylvania. We have 3 here in Maryland that are now certified by the state of Maryland. So imagine a new workforce, certified health workers, but located in your barbershops and beauty salons.
I do know this, that Alabama is doing the same thing now.
All right.
Dr. Harris, you want to tell me a little bit about that? I just want y'all to know, since y'all talk about Pennsylvania and Maryland and all of that. Hey. Okay, I'm through. Go ahead, Dr. Harris.
Come up with that idea, but listen, that's terrific. Community health workers are going to be the way, and it has to do with exactly what you were saying, Mayor. It has to do with trusted messengers. People are going to take advice from people they know, who know them, who care about them, who are part of their lives. A talking head on television like this, is not going to reach a lot of people, and I have proof of that after trying for 2 years to reach a lot of people. But people that in your life, that you see all the time, they're part of your community, they're part of your circle. Those are the people that you're going to listen to. And having people trained as community health workers is the way that not only we get through this pandemic, but it's the way we get people to make good health decisions forever.
One of the things that I know that there's an emphasis on, particularly in Alabama, is dealing with health disparities, right? And how do we address, issues of comorbidities and health disparities within marginalized communities, and being intentional about that. Talk a little bit about what the Alabama Public Health Service is doing to address those issues, Dr. Harris.
Yeah, Mayor, as you know, you and I have talked about this, many times. Health disparity is the reason we exist in public health. That's what we're here to do and to address. But this is not a new problem with COVID. COVID has just revealed the same health disparity that we have always had. It's not that there's a new one that's been created. Unfortunately, for too long, we have folks in our state who are at higher risk for just about every poor health indicator you can think of. And when we look at our maps of cardiovascular disease, they look kind of the same as the maps for diabetes, and they look kind of the same as the maps for infant mortality. And you pick a health indicator, and then unfortunately, a lot of people, a lot of communities are at the same risk for all of those problems, and that's just that just shouldn't be acceptable. Not nowadays. That should just not be allowed to go on. So we do have many people who are tackling this issue that we think that's sort of described a lot of times as social determinants of health. What the things that in your life that you're just kind of born into, that you don't necessarily choose. Your community, your environment around you, how far your own parents went to school, your race, your income. Those are all things that are just things that are part of our lives, but not things that we have a lot of control over in many cases. And yet those factors are probably the biggest thing that determines the trajectory of your health in life. There are other things that determine your health. Your personal choices make a difference. Your genetics that you're born with, that certainly makes a difference. There are all those factors, but the biggest factors are those social determinants. And so we have groups who work within all of our county health department that try to work out and raise awareness about that. We try to work with communities that don't have, for example, good access to care, communities that aren't aware of the resources that we do have available to them. We are trying to reach people that we know are at high risk because of those social determinants. And, you know, Alabama's got a lot of issues that aren't unique to us, but that are particularly troublesome here. You know, for example, we're not a Medicaid expansion state, and you know, we have a lot of people that just don't have access to care, and that's a, you know, really unfortunate situation. But we also have a really, as you know, a really unfortunate racial history, and we have communities that have this historical trauma. They've been marginalized. Our government has never made really great inroads into trying to build up the healthcare infrastructure or education or other things that would allow those communities to thrive. And that creates a situation where we see these health disparities, and it's a lot of work still to be done.
You know, Mayor,
Mm-hmm.
we were talking earlier about trauma at the individual level, uncontextualized what's wrong with that person. Same thing at the community. The people who live in those food deserts, the people who live in places where they don't have access, that's structural. But when we look at those communities and the suffering that they have, sometimes we might look and say, what's wrong with them? What's wrong with their culture? Why don't they take care of themselves? So important that the pandemic has pulled back the curtain on these structural issues that we're trying to address. And we can do that by raising awareness and having our barbershops and salons be places where we can put the context on why we are living sicker and dying younger. So here's the message from the shops, Dr. Harris. They don't want to go back to normal.
No.
Because going back to normal was living sicker and dying younger. They want to know, can the things that we've done, the innovative outreach we've done in the context of this pandemic, continue to address the chronic diseases and the risk factors we know are out there?
You know, I'm wondering whether or not telemedicine is going to be one of those game changers for us. But when you think about the fact of that many people do not have access to broadband in the rural areas, then that can be an inhibiting factor as well. Dr. Harris, how do you see this notion of telemedicine bridging the gap of healthcare in Alabama and throughout the country?
You know, telemedicine is a tool, and I would say it's no more, no less. It has a lot of promise for allowing people to connect with who may have transportation issues, who may have, you know, live in communities where don't have immediate access to care, and we think it's a terrific tool. We have telehealth services available through all of our county health departments now, all 67 counties.
Okay, good.
At least in some sense. We have programs working with other providers. We for example, we have a huge HIV care organization in Central Alabama that we have worked with to have telehealth services throughout the whole all of this part of the state. So it is a really useful tool. At the same time, you know, it still doesn't address a lot of those issues we just talked about. You know, if people don't have the ability to see a provider because they don't have insurance, they also usually can't see a provider by telehealth.
Right. Yeah, that's true.
And so, you know, again, it's useful, but it's not gonna solve all the problems.
So no panacea. And Dr. Ritter, you're on the front lines providing care. Are you utilizing telemedicine, and does it make a difference?
It does. I mean, how many of you have talked to a lawyer? Okay. When you talk to a lawyer, they charge you, right? 15 minutes, they'll charge you. Half an hour, they'll charge you, right? And how much advice do you get in that time? Well, you know, physicians have always given away their time on the phone because insurances have never paid for it. So to a certain degree, you can give and give and give until, you know, you go out of business as a physician. So, you know, for me, it's like, it doesn't take a video and an internet so much. It just takes a connection, you know, the voice to touch, to talk, to, you know. And so, you know, this is like the debate in the insurance companies now. It's like, are they going to pay for a televisit if it's no video? I mean, it's ridiculous, to tell you the truth.
Right.
It's just about economics right now. But yeah, I mean, you do need to talk to people. I mean, that's the first step. Do I need to go to the emergency room, or, do I need to worry that I'm dying? I mean, let's like de-escalate this by the phone, right?
Mhm.
So, we've always given away our time on the phone as physicians, but the pandemic has allowed us to charge for it. Now it's whether it's got a video with it or not. These are like details that are like ridiculous in my mind, and they have to go away. Let's just like talk to each other. Let's
Yeah.
get it happening.
Well, I don't know to what extent the kind of privacy issues when you're talking about videos and dealing with people personal, health. Um, I don't, I, that gets to be in the scary space for me as well. Let's see what the pulse is. Let's see what we think collectively. And the largest word, Dr. Harris, is hopeful.
All right,
And that
Dr.
means that
Harris.
most people out of the people who were respondents, they felt hopeful. And in the midst of all that's happening, and we know that there are people who are thinking about mental health, but you have to see expectations and thankful and community motivated and hopelessness. But you got God there, loving, empowered. Some people are sad and resolved and nervous and together and tired and grateful and so antsy, right?
Yes.
All of those are emotions, and one of the things that I want each person who responded to know that we all have felt those at different times, and so you are not by yourself. But I am appreciative that we are keeping hope alive, because that's what keeps us moving past our despair, is that we have hope that it will be a better day. And so I'm appreciative that hope is the hope wins out today.
Absolutely.
Right.
Absolutely.
That's wonderful. So one thing that we talked about, Dr. Harris, was the long haulers for COVID, and how that will impact the quality of life for people, not only in the deterioration of cognition and other uh, illnesses, mobility and things like that, but how will that uh, uh, ferret out over time? You talked about mental health over time and a lot of other things, that people did not go to the hospital that they needed it. And so now, we know an ounce of prevention is worth a pound of cure. So we have a lot of people who have their disease progressed because they didn't get it taken care of early, because they didn't want to go to the doctor, or that the hospitals were inundated with COVID patients and they couldn't get there for some reason. So we have not seen the rippling effect of what COVID has done. But Meg, tell us a little bit about the long hauler impact.
Yeah, there's still so much that we don't know about this, but clearly there are many people that continue to suffer symptoms for months, for weeks and months. That's a very well recognized phenomenon. The types of symptoms vary a lot, but we are beginning to see what we think are perhaps worse outcomes from cardiovascular diseases in people who have symptoms later on, perhaps strokes or perhaps heart-related issues that can show up weeks or months later. It's not always clear what's linked and what's cause and effect, but that's a phenomenon that's been reported many different times. I think in terms of children, we don't know anything, Mayor. I think there's so much that we don't know in trying to understand how kids are gonna go into the future, having been through a COVID infection themselves. Kids are resilient. They don't end up in the hospital with an acute infection as often, thankfully. Death sometimes occurs, but not often, thankfully. But what happens in the long run, we just don't know. And I'm reminded that in the 50s, when polio was an issue, a really highly effective vaccine was developed. It ended that epidemic. Polio became rare, and to this day there's no wild type polio existed in this country. And yet 40 and 50 years later, we saw people who were affected as children who began to develop issues again because of what happened to them, when they were children. So we just don't know about COVID. We know the best thing you can do is to prevent infection. And
Right.
so that means for your kids 5 and up, the best way we have to prevent infection is for them to get vaccinated. And then to use appropriate care when you're going to be around other people and mixing with other people and all the things we've been trying to say for so long.
Dr. Harris, you don't know how refreshing it is for me. And I say this with all sincerity, for someone to say at your level that there are some things that we don't know.
Yes.
Right? Do you know what kind of bona fides you established among people who think that people like you pretend or project that you know everything, right? I think the honesty that exudes from you, that there's some things that we don't know, and we're learning these things together, right? Right.
Mhm.
But there's some things that we do know, and this is what
Yes.
we know.
Here we go.
And once you can differentiate in that way, with that kind of clarity of thought and honesty and transparency, right? That's when people gravitate to you. I promise you, that's what happens. And that's what we got to do. That's what we got to do. Meg, tell us a little bit about long haulers.
So,
Yeah.
Dr. Harris, we got a public health minute in here that we call it. We do this every week on a theme that's top of the news. Take it away, Meg.
Absolutely. So this week we want to talk about long haul COVID. So the first thing I wanted to do was bring up what is long haul COVID. So the very first thing, it's symptoms that last 4 or more weeks after you got COVID. This can happen if you had no symptoms. So if you had an asymptomatic COVID infection, right? You feel like you got better, and after 4 more weeks, you start developing new symptoms. This can happen. Long COVID, as Dr. Harris was talking about, varies from person to person because COVID damages a lot of different parts of your body, and we really don't fully know yet what it does. So what are some of the things that can happen when you have long COVID? So when you think about, I kind of broke it down by where it happens, right? So you can have some issues after you've had COVID, thinking or concentrating. They call it brain fog. That classic change in smell or taste that can persist, even in kids. I know a kid that is persisting in, right? Tiredness or fatigue. You can be so tired, can't get out of bed for a long time. You can have migraine headaches. You can have sleep problems. You can have those breathing symptoms, right? So cough, difficulty breathing. You can have a pounding heart and actually dizziness too. You can have pain in your chest, in your stomach. This can actually change your menstrual cycle and cause gastrointestinal symptoms like diarrhea. It can have some nerve, that pins and needles when you sit on something wrong, you can have that feeling long term. And after you exercise or after you do something really cognitive difficult, you can get exhausted more than what was normal for you. So like I said, it's different for everybody. You might not feel all of these things, but if some of these things start popping up after you've had COVID, these are things to be concerned about. And the last thing I want to talk about is that sometimes people are experiencing long haul, or they're experiencing a long-term effect from having COVID because they were hospitalized. When you are hospitalized and when you go on a ventilator, it can cause long-term damage. Being in a hospital that long can leave you really weak. It can leave you with that brain fog, even if, so, and it can cause trauma, right? Because if you were hospitalized and if you were on a ventilator, you probably thought you were going to die. And that is a traumatic experience. People of any age can get long COVID. And we are still working out the patterns of who is getting long COVID. So that's kind of our intro.
Thank you so much, Meg. And we're going to have a continuum of educating people about long haul COVID, and its impact on on us. Dr. T, what you working
Well,
on?
one of the things I want to, again, Dr. Harris and Ritter, the metaphors that are used. Okay. So we've all heard flu-like symptoms. Okay. We've all heard common cold, if you get a light version, but the flu and the common cold doesn't result in the things that Meg just described. And I think once we let people know this is nothing just to casually get, if everybody's going to get it, I'll just get it, because we don't know these long-term consequences. And so we want to bring on to the show people who are experiencing this, people who have loved ones who are experiencing it. We want our barbers and stylists to be aware of these kind of symptoms. I remember in the early days of HIV, there were no HIV/AIDS specialists. Well, now that's an entire specialty. And I'm wondering if that's what we're going to see over time to deal with misdiagnosis and other kinds of things, that there will be people specializing in treating long COVID. You think that's in our future, Dr. Harris, Dr. Ritter?
I certainly hope so. I do. In order to do that, though, we have to break some silos down because there's so many organ systems. Like I'm a gynecologist, so Meg talked about the problems with menstrual cycles. So it doesn't happen a lot, but I've seen it. I mean, I had somebody who was ready to have like an infertility surgery, and then she had to be canceled because she got COVID, was asymptomatic, and we have to wait 7 weeks because they know that the insult of the anesthesia itself is hard on your lungs. And even asymptomatic COVID reduces your reserve in your lungs. So we have to wait for 7 weeks. And during those 7 weeks, that woman got hot flashes. And then I ended up testing her. She actually went into menopause during those 7 weeks from her COVID to her surgery. So her infertility surgery was canceled, not because she had COVID, but because she went into menopause because of COVID. So that's one thing, but then, the breakdown of the silos in medicine are very, very challenging. This is where we have to deconstruct, our system a lot more. There are no specialists in COVID right now, but I do believe the vascular coagulation is where we're going to see this inflammation. And I'm seeing it outside of medicine. You go on Clubhouse and you see a lot of people who are not doctors talking about inflammation and medications that you can take to reduce inflammation. I do think there is something there, but our medical field isn't really on board with all of that alternative type of medicine yet. So we do again need to talk to the community, and researchers are working outside of our field. And I don't know how long that's going to take, Dr. Harris. I don't know what your thoughts are on that. We need help, don't we?
No, that's a really good point. There's so much we just don't know, and I think we are learning every day. I think every time you encounter a patient, you get a little bit different story, and it adds another dimension to what we know. But there's certainly going to be in the future some better understanding, I think, and we'll have an idea of what we can fix and what we can't fix, and what our expectations are. There are actually there are other types of infections out there that we've all known about for a long time, and most of us have heard of, that can have long-term complications sometimes, and it's not always clear what can be done for them. But many people have heard about complications from, for example, a mononucleosis or Epstein-Barr virus kind of infection. Sometimes those can last much longer than is expected. There are people that have other types of infections as well that can come back for weeks or months with just different types of symptoms. There are a wide variety of symptoms, and it's not always clear, what's cause and what's effect. But I think that given that we've had 500 million people in the world infected with COVID, that's just the ones we know about. That's just the ones that got a test reported somewhere. 500 million people. We're going to have a lot more to learn, and we're going to probably be thinking about this a lot differently in 5 years than we are right now.
I'm thinking, Dr. Harris, about intentionality, not just, I'm talking about with specificity, tracking people who we know have COVID and really getting to understand how they're faring, with long haul COVID, over a period of time that we actually are tracking people? Have we come to that space yet, to your knowledge?
Yes and no. There are clearly many different research protocols going on around the world where medical centers, academic medical centers, are following these patients. We don't have large scale data collection right now, just on the average person in this city or that city that has COVID. Although there's definitely big pockets of information out there. So that body of knowledge is growing. It'll take a long time to get it to where it'll be really useful to use. We're going to get there, but we're still not quite there yet.
When Meg went through the symptoms, some of those things you can see when Sandra and her colleagues see their clients over time, they can see changes. But I'm wondering, and this is just wondering, if there's any symptomatology from COVID associated with hair loss, since that's the business they're in, whether it's alopecia formally or some version of hair loss. And again, all the things that we don't know, Dr. Harris and Dr. Ritter, our stylists and barbers might see things before they're reported to a physician.
Ms. Jenkins talked about that, Dr. T, and that's something that she's observed. Ms. Jenkins, you want to speak a little bit about that from your perspective?
Yes, absolutely. I really believe that there is a definitely correlation with COVID and hair loss in relation to the fact that it impacts, or either it has an effect on someone's mental ability that will bring on stress. Stress in itself can cause hair loss. Okay. And then you will have, autoimmune disorders and things of that nature. It can exacerbate that. So therefore, that then will, is a component of hair loss, whether it's related to diabetes, high blood pressure, all of those types of things, and medication is linked to hair loss. So therefore, COVID is very much, as surprising as it may seem, we don't want to accept it. It is a very important observation that is done in the hair salons in relation to hair loss.
Interesting.
That's interesting. I don't know if Katrina Randolph is camera ready. I don't see her camera on, but let's see if she can get the camera ready.
No, she's not camera ready today.
But that's okay. You can at least talk. Then just say hello.
Hello, everyone. Great conversation.
Tell Dr. Harris who you are.
I think Sandra just spoke for both of us. This is Katrina Randolph. I'm a certified community health worker through the state. I'm also the owner.
You have to say the state of. You have
the
to
state of Maryland. I'm sorry. I'm also the owner of Trey Shades Hair Studio in Capitol Heights. And I'm a part of this amazing network that we're in.
That's fantastic. It's very nice.
Yes. Nice to meet you too.
And Katrina, have you kept your mask admonitions in your shop?
Yes, I have. I don't have it on right now while I'm getting my hair done because the salon is actually closed.
Oh, so you getting your hair?
I ain't calling you out now. I'm just asking.
she getting her hair done
after hours.
Yes, I'm getting my hair done after hours.
Right. Well, that's fine. This is wonderful.
I just want to say for Dr. Harris, for Dr. Harris, I want you to see the atmosphere we create here, that we create that barbershop salon atmosphere for Katrina to come on camera. And we have watched her do an interview with somebody sitting in her chair who was hesitant. And by the time Katrina's done with her interview, the person in the chair says, "Hey, Katrina, when's that vaccine clinic going to be here?"
Wow.
So there's been conversions in the chair just listening to the conversation. That's why we need to keep doing this.
And actually, my stylist was just listening to the conversation and they were saying, "Oh, this is a great conversation."
And we want to stream this on the flat screen TVs in many of these barbershops and salons. And we're coming up with other interesting ways to demystify this information, like with a a graphic novel, a zine, other kinds of using visual arts. And we'd love to be able to share that with our clinical folks out there.
Yeah, and Dr. Dr. Harris, we do vignettes and small clips of the show. So we're going to pull a clip of you and we're going to proliferate that. Obviously, this is an hour-and-a-half show. So what we do is we take small clips of, a minute or 2-3 minutes.
Or 30 seconds.
30 seconds sometimes.
Yeah.
And we kind of put those out in all of our social media spaces. So look to see yourself a lot out there, because that's one of the things that we do. Let's go to Atlanta, Georgia, and bring up Andre. Hey, Andre Russell, how you doing, man? I can't hear you, Andre. Now, I didn't silence you. You did that on your own.
Well, I have to keep my eye on you, sir.
How are you doing, my friend?
I'm good, and hello, everybody. This is Andre Russell from Atlanta, Georgia, with the Barbershop Atlanta at the airport inside, and of course the mayor has actually visited it, because people didn't think they were really in the airport.
In the airport, I mean, I was there. I can attest to it.
Yeah,
Absolutely in the airport, in the Atlanta airport. Yeah.
And who else came to visit, Andre? You don't get yourself in
Katrina
trouble.
also came to visit.
There you go, Katrina came.
But however, she didn't get her hair done with us, so I don't know.
She couldn't.
And I
go
don't know
out.
why you're not open on the most busiest days of the week, Saturday.
Well, that's an airport thing, and they don't like for us to talk about it.
Okay.
Yeah. But I'm enjoying what we're talking about here today, because we've got some expectations about people not paying attention to what's going on. Somebody brought up hair loss, and we've had actual clients coming in lately, talking to some of my barbers and my stylists, saying, I don't know what's going on, I'm losing some hair. And of course, we always press it out as stress, and if they have high blood pressure or something. But obviously we're not doctors, but this is the first time that I've heard it actually related to a COVID situation. Mm-hmm. So I would love to have more information on it, because we strive on information. We must have it. Communication to our customers is a wonderful thing. So if we could have some tangible stuff that we talk to our customers about, that would be a good thing. And plus, even me, people tell me, said, well, your hair is getting short, and you own 9 barbershops. And I said, well, I don't own 9 barbershops anymore, but my hair is getting short. But that was a whole lot of pressure and stress. But if there's a COVID thing, I'd love to have yet again another something to talk about.
Well, that has come up because of an observations. And so Dr. Harris, Dr. Ritter, citizen scientists, our barbers and stylists can be prepared to look for certain things, to be on the lookout. In a previous show, we had Dr. Tuesday Cook on, and she described erectile dysfunction associated with COVID. Why? Because it affects the cardiovascular system. I'm thinking that some of the men out there, if they actually knew that, might help bring down some of the vaccine hesitancy. They think it's the cold or the flu. It's not. So we're going to give more emphasis to these long COVID symptoms and helping people manage them and communicate with their health professional so that they don't have misdiagnoses.
Yeah.
We need to know what to research, because if we didn't know that there could be a possibility, we won't research it. I know there are some studies out now that have shown people who have died after they've had COVID, not from COVID, but they've seen this COVID dead virus particles within their body, but they're looking at it in the heart and the lungs. They haven't looked at it in the scalp. Maybe the virus is clotting off the little blood vessels to your hair follicles, right? But you have to study it. So, if we don't know what to study, we won't study it.
Right.
So your
I'd love to have something to concentrate on, because
yes,
I've got years of hair. I'm plus 70.
Yeah, absolutely.
I'm not looking forward to having no hair. But I do have a meeting coming up with some of our Emory people.
Okay.
Because they're looking for another focus for their people, And since we said this, I'd like to bring it up. So if somebody can shoot me some information, I've got like 2 or 3 weeks before I meet with them, something that I could place on the table. I'd really love that.
Excellent. You know,
That's
Dr. Harris, here's another example, silver lining that Andre, he had a relationship with Emory School of Medicine before, but now it's so robust. They've done over 1,000 COVID vaccines in the area.
We're plus 2,000, plus 300 flu vaccinations.
Wow.
Plus, I think I asked them actually today. So we're somewhere around 500 boosters.
Okay.
So because they're getting ready to close down at the shop because we're closing down at the mall. But I said, can I get some numbers? You sure? Yeah. Here we go. And so, so we're going to. I'm going to get some of those things down to you on paper so you know that.
Please.
Andre's not kidding, you know.
Right.
That should be lifted up.
Yeah.
That should be celebrated. That should be in the American Journal of Public Health and in the local conversation about that relationship and how transformative it has been there in Atlanta.
Dr. Harris, you wanted to say something.
Sorry, guys.
No, I was loving that story, but I was just going to say, I mean, there's no question that you were able to reach hundreds or who knows how many people who might have never gotten vaccinated, but for your interaction with them. I mean, you know, that's the difference that you can make in people that you know and who know you and who see you and trust you. They aren't, you know, showing up at a random health department somewhere, you know, to get a shot. They're coming to see you, and that's the reason they did it.
Right.
You're absolutely right.
Plus, I'm a nice guy anyway. So.
That's not why.
hey, Mayor.
What?
Mayor, our research team has gone to work listening, and Meg has some information on the hair loss and COVID.
Oh.
Hey, Meg, what you got?
That is fast.
Yeah, on the spot. So I'm actually going to ask Miss Sandra to help me a little bit because I don't understand hair as well. So, okay. So from what I understand, your hair is in 2 phases, right? It's in growing phase and it's in like dormant phase when it's done growing.
Yes.
Right? And then after it's done growing, you lose your hair. You shed naturally.
Yes.
Okay. So when you get COVID, sometimes what happens is your body shifts some of that hair that was growing over into done phase. And then you shed more because you have more dead hair.
Exactly. And so there's another factor we have to take into account that, you know, because there is COVID in its relation, to let's just say a cross contamination or more of a infectious disease, a bacteria, you know, means of contracting it. Therefore, it can cause an inflammation in the scalp area, and therefore it can actually suffocate those follicles. So therefore those follicles are suffocated, it's squeezing around that one hair strand, and therefore it cracks and it breaks off. So we have to be very, very, very conscientious about those types of services that we provide in the salons.
And Meg, give the audience a source.
Okay. That is from the American Academy of Dermatology Association.
Okay. So look at the range from OBGYN, cardiology, endocrinology, what Meg just said, and they're all in silos, Dr. Harris. They don't even talk to one another. So I think we in the community have to start demanding that they talk to one another. And that's why, Omar, you're seeing these patients come together to try to solve their own problems.
Yeah, now I know when my hair just got choked to death. That's all.
There we go.
I never do it. They just choke each other. God, you ought to get out of here.
But what we do have as this new organization, we do have a chain of where we get our information from, like Dr. Scott, where we can share this with hundreds, perhaps thousands of people that would not get this information anywhere else.
Yes.
Yeah.
Yeah. So if we could get it, but we love to have factual information.
Correct.
Right.
So that we don't start spreading information that's not true
Yes.
or can unfounded. People can't research because I tend to talk a lot, and I tend to talk in groups. So when I say something, I like to have a basic gravity to everything that I say, so that people can research what I say, and I can't be putting things out there that are not true,
Right.
And things that have no direction.
Well, that's why you come to the cutting edge.
Right.
There you
You
go.
don't want to be
You
out
get
there.
it straight here.
You don't want to be out there spreading ignorance. I mean,
Yeah, I love this place. I love this place. Yeah.
That's wonderful. Let's go to Philadelphia. I mean, let's go up to Philadelphia. Stacy Ruffin with Rejuvenate Philadelphia. Let's bring her up. Hey, Stacy, how you doing, sweetheart?
Hey, Stacy.
I'm actually doing great. How are you guys doing?
What happened to you? What happened?
Turn your camera back on, Stacy.
What happened to you?
My sister's calling me at the same time. I'm trying to figure
Would
this
you
out.
tell her to
Yeah,
stop
tell her to
calling
hold
you?
up.
She's calling you.
So I'm going to be curious how Andre and the other stylists and barbers think about putting this information in like a graphic novel kind of format, demystifying the science but still communicating the facts. That's what we're trying to get to.
Well, that's going to be powerful. And so, when one is we want to get Stacy back. I see she's connecting back. But let me
All right. I'm sorry about that.
Okay. Now, no, that's okay.
Yeah.
That's okay, sister's fine. Bring Stacy up so we can.
Yeah.
We can holler.
You got good light tonight, Stacy. That's good. We can see you
Yes.
good.
I have 2 cell phones, but I wanted to speak about the hair loss. I have 2 clients that had the COVID, and where their hair was just amazing. Now, one still is childlike. The COVID went to her brain. So she's still, and she's exactly 41 years old. So she never recovered. So she can't work anymore because she doesn't remember her job. So she has hair maybe halfway down her back. And it came out like, I could say, maybe a whole grocery store bag of hair.
Oh, wow.
So the same household, her mother-in-law, they lived together. They all had COVID at the same time. And they had really long hair, and her hair came out in grocery bags.
Wow.
I'm saying they had beautiful, long, beautiful hair, but now it's still long, but it shed and it went out. It left. It's just weak.
Did you see any change in her personality when that happened?
Well, what happened was when she got sick, her husband works for SEPTA, and he got sick first. But he was asymptomatic, and she got sick, and she went like straight to childlike. It like hit her, so she was in the hospital, I say, for about 2 months or a little more. And she, they did every test, but they said that the virus entered her brain. So that's why it's something, and that she's still going to therapy, but she knows who I am. And like certain people, she know who I am, but she doesn't know who her sister is.
Boy.
And it's like certain things they try to get her to remember, but this girl was amazing. Like, she worked, and she was a wife and a mother, and now she is childlike, but she will be able to talk to you, but she'll talk like she's 12 years old, maybe. But, and her mother-in-law, Lisa, she actually works here. She's fine, but her hair never recovered. It's still really long, but it's very thin, all due to the COVID. And that's what her doctors are telling them it came from too. But I've been doing their hair for about 20 years. And it's after, it happened right after the COVID.
And you saw the correlation between
Yes.
when it happened and what happened.
Yes.
Wow.
Yes. Yes. I mean,
that's obviously something that we need to look at. There needs to be some study, some significant study, because people, their self-esteem oftentimes is attached to their hair, and that's for men and women. And so, so that's something that we need to really talk about. Right. Well, right. All right. So, you know, we do you know, Dr. T? I think we got 5 minutes left.
Oh, man,
How
time flies.
You know what that means, Andre, right? Dr. Harris, you know, if you could come on every week, you would be welcome to be with us. We are so appreciative of you. Every time you come on, we are enlightened, we are smarter, and we recognize how committed you are to this cause. And you know, when you get it down to the brass tacks, when you just, you know, put it where the cows can get it, what we're trying to do is really save lives. That's it. And we're trying to give people the requisite information that they need, believing that when they get the right information, they will naturally gravitate to take care of themselves, right? And so we're giving them the proper information, and we're also telling them when we don't know something.
Yes.
And if you notice, Dr. T, as Meg, to source it,
yes,
so that if somebody is questioning something or would like to get more information about it, then they can go to that source and then further investigate or research what she's talking about. That's we want to do more of that to make sure. We don't want to make this an academic exercise, but at the same time, we want to let people know that we do have reliable sources by which we get information. Dr. Harris, I want you to say a few things before we leave.
Sure. First of all, thank you so much for having me. It's such a terrific forum, and I know I thought this the last time I was on your show, but I'll say it again tonight. I think I learned the most on the show. I mean, I just love hearing from people, I mean, who really are on the front lines in a way that I'm not, you know. And anyway, it's really good for me to be able to be here with you. And you summed it up exactly right. We're here to help other people, and I don't just mean those of us who work in public health. I mean, that's why we're all here in the big picture. I mean, we're just here to take care of other people. That's what we're supposed to do. And you know, the profession I have is in public health, and that's how I try to take care of other people. But everybody has their own skills and abilities and expertise, and we all are here to take care of each other. So just thank you for letting me be part of it. I love being on this show. I'm always happy to join you anytime you'll have me. And I just want to wish you the best to keep doing the great work you're doing.
Thank you so much, and we appreciate you.
Give Dr. Harris some snaps
absolutely,
here.
Absolutely,
cutting edge.
Absolutely.
This is our standing ovation.
That's how we give you a standing ovation like this. And you know, and let me tell you, you are backed by popular demand.
Yes.
I just want you to know that we have gotten so many really wonderful comments on when you came on with us before, and so that's not hyperbole. We're telling you that people really appreciate you. And this is
Absolutely.
all over the country. This is not just in this circle. So we are so appreciative of that. And I'm so proud of you being from Alabama, living in Alabama, and that you are my, you know, top man for the health, right? That's it's possessory interest for me.
Wait, don't hold anything back now. Just go ahead and tell them how you
know, I'm just telling them just how I feel. You know, I don't know, ain't no shame in my game. I tell people exactly how I feel, right? And so I really, I consider Dr. Harris a friend. I mean, I really, based on this COVID thing, is really brought us together, and I consider him a friend, and I know that he's a friend to the people of Alabama, and based on what he's doing to try to save lives. Let me go to circle around. Dr. Ritter, what's your last thoughts? We got 10 seconds for you.
Yeah, everyone uses the word hope. I use the word faith. I have faith in humanity that we'll get through this together. I mean, hope is from somebody else, but faith is within ourselves. So keep the faith.
Good.
Keep
You
the
have 2
faith.
seconds, Ms. Jenkins.
Yes, I would like to piggyback off of Dr. Ritter and Dr. Harris and everyone's here tonight. Keep the faith.
Good. Ms. Ruffin, you have 2 seconds.
Yep.
Somebody
Yeah.
called her right now,
All
right?
right.
As
No,
it's finished.
not- I just
Okay,
want to say,
go ahead.
have a great night.
Katrina, you got 2 seconds.
2 seconds. My time is up. I just say good night. It's always a pleasure to be on these calls and for the salons and barbershops. Keep on standing up for what's right so that we can continue to make a difference.
Thank you so much. Andre, you have 1 second.
I just want to say, the visual thing that Dr. T is talking about, where we set up something like some vignettes, I think that'd be perfect. People learn more today through visual than they do reading. I think that's great.
Thank you so much. I appreciate
problem.
each and every one of you. Dr. T, my man, thank you so much for all you do. You are an incredible leader, a visionary. And so thank you so much, my brother from another mother. If you want to say something at the end, please say it because I want you to have that last word today.
Well, keep hope alive, keep the faith. And Andre, we're going to show you what the artists can do to bring that message and make it come alive in our barbershops and salons, and to have the voices of your clients and you stylists and barbers reflected in the graphic novel. And I can't wait for Dr. Harris and Ritter to see these new communication channels that we're going to develop from the grassroots, and hopefully get support in ensuring that those stories are in the barbershops and salons across the country.
As always, I'd like to leave you with these 2 words. Remember that I love you with the perfect love. But more importantly, remember this: you got the power. Thank you for joining with us on this segment of The Cutting Edge, and we'll see you next week, same time, same station.
All right.